pleased to have with us today Tara Straw. Tara is a senior health policy analyst with the Center on Budget and Policy Priorities. She specifically works on the implementation of the Affordable Care Act and the premium tax credits, the tax provisions of that legislation. And I met Tara when I was in Washington, D.C. for a seminar put on by Center on Budget and Policy Priorities. And she explained the Affordable Care Act and the premium tax credits in a way that I could understand it easily. And I've used the resources she's provided in presentations that I've put together for our extension homemakers and our early childhood educators that we've trained thousands of people with the materials that she's provided, and I'm so glad she was able to join us today. So thank you, Tara, for being here.
Thank you. So, there's so much that we could talk about with premium tax credits and the Affordable Care Act, and it's a little bit intimidating, the amount of information that's out there, but I also know that some people have done quite a bit of work there, and so you may already know a lot of this. So we're going to focus on kind of two areas. The first is the premium tax credits, a little bit about how they work and sort of what the pitfalls are that people sometimes experience that we've seen over the last couple of years. And then we're going to take a real dive into choosing a health insurance plan because it's so consequential. For those of you coming to this from the financial planning world, it is so consequential what plan you choose. And we're going to talk about some of the language, the terminology that's used with these plans, and how these plan decisions are made. And it's the language alone, I find pretty frightening. But we're going to try to break it down and explain how this works, and it'll be very clear sort of how the range of plans that are available in the marketplace and outside the marketplace, and how you understand them, and maybe that will help you guide someone else in understanding their plans. So the Affordable Care Act, still gets a lot of guff, but it's helped us greatly reduce the rate of uninsured people in the country over a very short period of time, and those gains have been felt by people across the age, ethnic, race lines. Everyone has seen gains. So, you can see among African American adults, the uninsured rate has declined by more than 50%. That's pretty incredible over a couple of years. And the number of uninsured people has declined overall by 12.8 million people, and still falling. Those numbers were just to 2015. And those gains have been made because of two programs primarily. This is the Medicaid Expansion and the marketplace enrollment with premium tax credits with that financial assistance. At this point, 32 states have chosen to expand Medicaid. There's still work left to do to help the other states expand. There's a lot of federal money that they're leaving on the table, and a lot of uninsured people in those states at very low income levels. And so it would be great to see more states expand, but so far so good. And then we have the health insurance marketplace, which has financial assistance available to purchase private plans. In 2016, or for 2016 enrollment, 12.7 million people signed up during open enrollment. And the vast majority of those folks had financial assistance. And the financial assistance comes, as you know, in the form of an advanceable tax credit. And that tax credit is huge. The advance is huge. The average subsidy was $290 per person per month. So this is a tremendous amount of money that's available to people up front to help them purchase a health insurance plan. But of course, when people purchase it up front and get that advanced premium tax credit, it's based on their projected tax filing status, family size, and income. And those things can be difficult to project. And then the final premium tax credit is calculated on the tax return. And so if someone has had if someone fills out the application and they overestimate their income, and then at the end of the year on their tax return they have lower income than anticipated, then they can get more premium tax credit. It's refundable. However, if they underestimate their income, then they're going to find that they will owe money at the end of the year on their tax return. Luckily, though, there are repayment caps on the amount of money they could owe if they receive too much advance credit. Most people in the marketplace have income under 200% of the federal poverty line. And for those folks, the repayment is capped at a fairly low amount. So single taxpayers will owe back no more than $300, and other taxpayers will pay back no more than $600. So some of the key misunderstandings, this is where people can go wrong in their marketplace application. And in part, this is because the calculation of the advanced premium tax credit is really based on some very tax-specific terms. But the questions are asked by a healthcare system and by people who understand healthcare more than they understand taxes. And so sometimes things can get lost in translation. It's really important that people understand what they should put in their application, and I think the marketplace, sort of in fits and starts, is getting a little better at that. One of the things to think of is that people wrestle with sometimes is who is in their household. So in general, when someone applies for marketplace coverage, they're looking at including the people who are in their tax household, who they expect to claim at the end of the year on their tax return. Now, in some cases, that's going to be really obvious. In other cases, it's not. In other cases, there are times when there might be people who are non-dependents that still need to be included on the application in some capacity and in answering some questions to calculate Medicaid eligibility. So it's not at all, it's not easy to explain to folks sort of who they should include on their application and who they shouldn't. For instance, if you have a non-married couple living together with a couple of kids, the couple will need to file separate tax returns if they're both earners, and because they can't be on a joint tax return as joint filers if they are not married. However, for the purpose of Medicaid eligibility determination, the Medicaid system would want to know both parents' incomes to determine the eligibility of the kids. So there are all sorts of special rules, and luckily the application sort of walks you through question by question. Another thing people struggle with is what is projected income. Some people, they have multiple jobs, or they have part-time jobs or overlapping part-time jobs, seasonal work. It can be difficult for people to look ahead a full year and really be pretty accurate in projecting their income. This is also true for people who are self-employed and may not know month to month how much they're earning. And, a lot of people are really flummoxed by farm income, which can include things like depreciation and some other, fairly complicated tax concepts that a lot of people who are helping you with a healthcare application are not going to be very, very comfortable with. So there are a lot of pitfalls in projecting income that people have to wrestle with. And even if you've done all of that accurately for at the time that you enroll, it's still important that folks understand what the reporting requirement is for changes to income or to your household. And it's important to report changes because, if things sort of get off track what you had estimated based on your income or your household, then you might have problems in reconciliation. You might, if you have one job and then you get a different job and it pays more money, you might find that you owe back money on the premium tax credit. So, we're all sort of moving the system in a way to try to hopefully make it more transparent and to give people sort of better clues about how to get through. And we're trying to learn from our experience, but still, these are the areas where people still need some help. Now we're going to dive into plan choice, which is really, really critical. I mean, it's one thing to get through the beginning of the marketplace application where you're entering all of your financial information and your family. That's hard enough. But then, the application says, okay, so you're eligible for premium tax credits. Now go pick a plan. And that's where some really consequential decisions are made. And often, people just don't have good information, and the people who are explaining plans or who are being asked questions or people who help people with things like financial planning just aren't very comfortable with it. So we're going to talk through some of the terms that are used in this insurance plan selection process, and then put them together in the selection of a plan for a family. So first, of course, premiums are the monthly cost a person pays for their health plan. This is a concept that most people understand. Where it goes awry is when we start adding in cost-sharing charges. So cost-sharing charges are the charges that you pay to use a benefit that's covered by the health plan. So to get your prescription, to go to the doctor, to get rehabilitation. Cost-sharing charges come in a lot of different forms. One that's very key for the marketplace and for, frankly, the purchase of any private health plan these days is the deductible. So the deductible is the amount that the enrollee must pay before the plan begins to pay for most benefits. It's set on a yearly basis. This is the amount that you're going to need to spend upfront in charges for services. It doesn't include the premium, but in charges for services you get before the plan pays anything. Now, some services might be exempt from the deductible. For example, a plan might say that they allow 2 physician visits before you meet your deductible, and maybe just for the cost of a copay, which we'll talk about next. Other benefits may have a separate deductible. For instance, you might have a general, $2,000 deductible on medical services, but a $500 deductible on prescription drugs. And so you need to spend $500 on prescription drugs until your prescription drug benefit kicks in. The other amount, one of the other forms of cost sharing is copayments. Copayments are the dollar amount that you pay for an item or a service. And some copays might be applied before the deductible is met. So, for example, that example of allowing 2 physician visits in a plan before the deductible is met. Well, in that case, they might say physician visits are, $20, a $20 copayment. So even if you haven't met your deductible, you'll still pay only $20 for the physician visit. Another item that comes up is coinsurance. Coinsurance is where there is a percentage, the person pays a percentage of the cost of an item or service. So they might say you pay 10% of the cost of a specialty visit or something like that. Other terms that people should be familiar with is covered benefits. Covered benefits, there's a list of 10 very broad benefit categories called the essential health benefits, and every plan in the marketplace needs to cover those benefits. And outside the marketplace, every health plan needs to cover these benefits. Some health plans choose to cover additional benefits, but that's really at discretion and in the plan design. So beyond the essential health benefits, you have to look very carefully to see what's covered. Also, the important to a lot of people is the provider network. One way that plans have been cutting down their own costs is by having narrower provider networks. So maybe you'll have fewer doctors in your area, or the plan is trying to steer you toward particular doctors or hospitals or other professionals in your area, because they've only contracted with a certain number of them. Or you may, put a primacy on choice and having a lot of providers. So the provider network, whether it's broad or narrow, is something that someone should consider if they're purchasing a health plan. Another concept is the out-of-pocket limit. So the out-of-pocket limit puts a cap on what the enrollee pays in cost-sharing charges each year. So again, we're not talking about premiums. We're just talking about cost-sharing and everything, the amounts that you pay for a service. This is set on a yearly basis, and it applies to in-network services, not out-of-network care. So the out-of-pocket limit is your overall cap, but remember to distinguish it from a deductible. So you're not necessarily going to hit the out-of-pocket limit, and you don't necessarily have to pay that amount of money. But what this says is that if you have gotten to a point where you've paid for 2017 as an individual $7,150, if you've spent that amount of money or been billed that amount of money, then your plan is going to pick up anything else. But it's fairly rare unless someone has a catastrophic illness for the maximum out-of-pocket limits to come into play. Coverage is broken up into different tiers, and those tiers are the metal levels. So there are platinum, gold, silver, and bronze plans. And then there's catastrophic coverage, which is a high deductible plan that's only available to some individuals. The distinction between the different metal levels is how much care they pay for. So everyone covers the same set of benefits, the same sort of broad 10 categories of essential health benefits. But if you have a bronze plan, then they're telling you up front that the actuarial value of the plan is 60%. That means that if you look at a whole population and you estimate the amount of health expenses that population is going to have, this plan is going to pick up, on average, 60% of that amount. Whereas if you have a platinum plan, you look at the same population, you think about all the expenses they would be anticipated to have, the platinum plan would pick up 90% of their expenses. So it's a more generous plan. And so because a platinum plan is more generous, you also expect their premiums to be much higher. In general, if you have a platinum plan or a gold plan, the premiums are going to be higher. And if you have a bronze plan or silver plan, the premiums will be a little lower. Now, silver plans have special distinction in the marketplace because if you have a silver plan, then you might be eligible for another special benefit called a cost-sharing reduction. And cost-sharing reductions help reduce the out-of-pocket charges an enrollee pays for medical care covered by the plan. And people with income up to 250% of the federal poverty line are eligible. But again, you only get this benefit if you've enrolled in a silver plan. And so where some people mess up is that they're really thinking about premiums. And so they look and they see, well, the silver plan premium is $150 a month. The bronze plan premium is $100 a month. $100 a month sounds better to me. And they don't look at cost sharing. And they don't look, and so they choose the bronze plan and they don't get the cost sharing reduction. And you can see how consequential it is. Now there are a lot of words on this, but let's just look at an example of how consequential this can be. So let's take one standard silver plan. If you have income that's above 250% of the federal poverty line, this is a standard silver plan, and so it'll cover roughly 70% of your costs, and you can see what the out-of-pocket limit is. It's the max out-of-pocket limit. But if you have income that's a little lower, you qualify for a little bit of assistance, and so the plan was expected to cover more like 73% of your actuarial value, and your out-of-pocket limit is lower. But if you go the whole way to the right of the screen, and you have someone who has income of less than 150% of the federal poverty line, you can see that this plan is going to cover 94% of their costs, and the out-of-pocket limit is much lower. And this is all the same plan. All the benefits in the plan are the same. But when you purchase through the marketplace and you get a silver plan, there's a lot of math happening in the background between the federal government and the health plan that is taking your $25 copay and that is reducing it to $10 because when you applied for the benefit, they determined that you qualified for special assistance. And so people don't even see it necessarily. But they get that benefit because they get lower costs than they would have if they had a higher income and purchased the same plan. And so here's another example of what that looks like. And this was an actual plan that we pulled from Pennsylvania. We haven't updated it. This is a 2015 plan. But if you take, this is a Blue Cross HMO plan, a silver plan, without any cost sharing reduction, just your standard plan. Again, it covers 70% of actuarial value. That's the benchmark the regulations say the plan has to meet. The deductible for this particular plan was $4,500, which means that you have to spend $4,500, with some exceptions, you have to spend $4,500 before your plan kicks in. The out-of-pocket limit was $6,300. And then there were some primary care visit copays, specialist visit copays. And then if you move to what happens if you have some cost sharing reduction because your income is between 200 and 250% of FPL, you can see automatically that deductible is already dipped down to $3,000. So it's a very little difference in income, but you've already gotten a lower deductible, and the co-payments are lower as well. And then if you go across the screen to someone who has income of less than 150% of the federal poverty line, you can see that same plan that the person without the cost sharing reduction purchased, now for this lower income person only has a $250 deductible. So this is why it's so consequential that people understand what plan they're choosing, because you can see the huge variation. This is just one plan, depending on what their income is and whether they've chosen a silver plan to get the cost sharing reduction. It's really something people don't fully understand. There's been a lot of talk about the tax credits and not a lot of talk about this, but you can see what a huge difference it makes in someone being able to afford care or not. So how do we put this into action? There are a number of considerations that we need to think about in talking with a person about what health plan is right for them. So premium is the one that people always go to first, and folks understand it, and sometimes you've got to sort of get them to see something else, because the premium, a lot of people think is sort of the beginning and end of the story. The plan design is important, whether there are visit limits, whether there is a prescription drug formulary, what the provider network looks like. These are the things that are going to make the practical difference in whether someone feels like they have good insurance or not. So there's a document called the Summary of Benefits and Coverage, or SBC. This is available for every health plan. Some are easier to get than others, but even your employer-sponsored insurance should have an SBC. What this attempts to do is to put down in one standard format to answer all of these questions about the deductible, about out-of-pocket limits, about provider networks, to put it all in a standard format so you can compare apples to apples across plans. So they will use all of these terms, but they also define them. So they'll define co-payments and co-insurance, but it's still a really daunting amount of information. So people often need a lot of help with it. And then there are some things that are really important to pay attention to, like when a benefit isn't covered. So for instance, this is one page of a bronze plan out of Texas, and if you used a participating provider, there was no charge for all of these particular special health services. But if you used a non-participating provider, so if you use someone out of network, it's not covered at all. So that is a hugely consequential detail for someone who might need home health care, for instance. It's the difference between not being paid anything for it or getting no help at all from your plan. So that's why some of these details in the coverage documents are so important to understand. And provider networks can be a huge frustration for some people. You might have plans that have fewer doctors, fewer hospitals that they contract with. And if you go out of network, then you'll pay higher costs or maybe not get coverage at all. Versus the plan B here, which has a broader network of doctors, it's probably a more expensive plan because that's the trade-off. And then you have plans like Plan C that might be integrated, where, you know, like a kind of Kaiser model, where you go to, it's very tightly limited, where you go to a particular kind of branded doctor. So if you're talking to someone about, you know, about all of these complicated decisions, it can be a little bit difficult to figure out, you know, with all of these considerations, where do you start? So we start with a person's priorities for health coverage, and what services and healthcare providers they expect to use. And from there, we can help someone make a good financial decision for them that's going to protect them from a lot of unexpected costs. We ask about specialists and medications. We have a worksheet that we've developed that helps you sort of compare plans to one another. This is downloadable from our website, and it's nothing fancy. I wish you know, we had the magic wand, or we could just you know, you can put in the plans you're considering, and we could say yes, this one is the best one. But it's not that easy, unfortunately. But it does help to really compare them side by side and discuss the trade-offs. And we're going to do this in one example, which right now before we wrap up. The example is Joe and Danielle, and they live in Miami, Florida. Their income is $41,000 a year, which is over 250% of the federal poverty line. And that means that, unfortunately, they're not going to qualify for cost-sharing reductions. So we'll need to keep that in mind, but they'll be eligible for a premium tax credit of $198 a month. They have a special health concern in that Joe has asthma. So Joe has a pulmonologist that he prefers, and Joe has medications that he needs to make sure are covered. So as we talk to Joe and Danielle, we're going to ask them about what their priorities are. Their priorities are a low monthly premium, but maybe instead they care more about the deductible, since Joe is, they know that Joe is going to use care, so maybe they care about the deductible more. How do they feel about copays and coinsurance? And do they expect to use primary care and want to use it pre-deductible? So kind of trying to negotiate all those terms with Joe and Danielle is going to be our priority. In particular, Joe and Danielle want to make sure that Joe's current doctor is in the network, because he likes his doctor, and he wants to know how much his asthma medication is going to cost. So we can help him do that with the information that the healthcare.gov has given us. And I'm talking about healthcare.gov and their interface, but the other state-based marketplaces have a very similar interface and usually have the same information available. So we've narrowed this down to 3 kinds of plans, and we're going to walk through those options for Joe. And we're going to use all of the terms that we've just discussed to explain to Joe and Danielle what these plans have to offer them. So the first one is an option from Ambetter, and the health plan name is Essential Care 1 plus dental. It's a bronze plan. Now, we said that Joe and Danielle don't qualify because of their income. They don't qualify for cost-sharing reduction. So there's no, they're not going to miss out on anything by going for a bronze plan. But the plan type is an EPO. And that's going to be new to some people, right? EPO. So an EPO is a plan that has a very limited provider network, and you only can use those providers. There's no coverage for providers that aren't in their network. So there's basically no out-of-network coverage in an EPO. Okay, well, that's important for Joe to know, because if his doctor isn't in network, he's not getting any help paying for her out-of-network. The monthly premium looks pretty good. It's going to be $285, but the deductible is $13,000. So that means that they're going to have to pay $13,600 before they get any care from the plan, which sounds like a lot for most people. let's compare that to the second option, which is Molina. There's a silver plan. It's an HMO. Okay, so there'll be restrictions on providers, but there will be an out-of-network option. The deductible is much lower. It's $4,000, but the premium's higher by about $50, $60 a month. And here the deductible is $4,000 for medical, but it's there's a special drug deductible of $400. And then our third option that we're going to look at is Coventry. This is a gold plan, so the premium is going to be higher, but the cost sharing is going to be lower. And here the deductible is $2,800, so it's our lowest deductible plan, but it's also our highest premium plan. And there is also a separate drug deductible of $250. So let's look at the cost sharing charges for these plans. So Ambetter, you can get a generic drug for $20 pre-deductible. So before you pay all of your $13,600, you can get a generic drug for $20. But nothing else is pre-deductible. And I think that some of these, this is where you really need to know your healthcare terms, because if I'm just average Joe consumer and I'm looking at that number and I'm looking at this information, I'm going to see no charge, no charge, no charge, and I'm going to think that's awesome if I don't understand the deductible, right? Because if I don't understand that I need to pay $13,600 before I get to all of that, no charge for a primary care visit, no charge for a specialist visit, no charge for an emergency room visit, then I'm going to make a bad choice. So, and then let's look at Molina. So there are a lot of things actually that are pre-deductible. You can get primary care visits, specialist visits, generic drugs, preferred brand name drugs, all prior to meeting the deductible. And Coventry also has some pre-deductible services like primary care visits and specialist visits. So there's a lot to understand about these plans. There were a couple of things that Joe and Danielle wanted us to take a look at. One is whether Joe's current doctor is in the network. Here's the doctor's name. And so we can go to healthcare.gov. And again, I think most state-based marketplaces have this capacity too. We can go to healthcare.gov and we can type in the doctor's name and search, and we found her. She's in Miami, Florida. And then we can see whether she's in or out of network for each plan. So for Ambetter, she is out of network, and for the other two plans, she's in network. Well, that's helpful information for Joe to know. So we'll add that to our chart. He also wants to know if his asthma medication, if his inhaler is covered or not. So we did a search for his inhaler, Flovent, and we found that, well, it's covered for Ambetter, but not covered for the other two plans. So again, useful information for him to know. And so we put that on the chart. And what we can do, what we don't have here, but Joe will probably know, is what is the cost of the asthma inhaler pre-insurance. So we would need to do some homework to figure out what the cost is pre-insurance, so we can figure out what added price he would have every month or every other month. So we'd want to add that to our expected out-of-pocket costs for the plans. But then, unfortunately, like I said, there are no magic answers. So we would just have to talk to Joe and Danielle about which plan works best for them based on all of these factors. And unfortunately, I haven't selected one for you. That's the end, because there is no golden answer. And that's one of the frustrations that people experience in plan selection, is that there's so much information and there isn't always a clear answer about what works out best for them. At the same time, there is a lot of choice between plans. Even if you just have one insurer in the marketplace, which is the case for some people, they're offering a variety of plans, and it's really important to understand these terms to know how to go about making a selection that's the best for you and your family. So this is the kind of information that that a lot of people need help understanding, but that has obviously huge consequences on a family's financial well-being because of the variety of costs they may face in trying to use their health plan. So with that, I don't think we have any questions right now, but if anyone has a question, I'd be happy to answer it.
Tara, did I get that link right for the comparison worksheet? I put that in chat.
I do not see.
You don't.
I don't see the chat.
You don't see that in
Okay,
chat.
hang on 1 second. Let me see. That looks right to me.
Okay, yeah. I mean, I just Googled comparison worksheet or healthcare comparison worksheet. So, yeah, we'll just hang out for a bit and yeah, just see if we have any questions that come in. Tara, are they still is the government still providing counselors? I know when I know when the new healthcare law was put into place that there were counselors in place and people were working with people. Is that something free that people can still take advantage of?
Yes, there's still a lot of free help available. There's help available from community health centers in particular. Those folks, they know these terms inside and out, and they can really help people, especially people with complex medical needs, understand their plan choices. There are also a variety of sister organizations where they're not allowed to take any money from folks to help them with this, and they just walk through the publicly available stuff. So there's no hiding the ball. And also just insurance agents and brokers can be helpful too. But at healthcare.gov, you can put in your zip code, and you can find all of the people around you that offer free assistance.
Looks like there's a question in the Q&A.
Yeah. So the federal poverty line numbers, those. I didn't want to get too bogged down in them. The important thing to know, I think we're looking at open enrollment starts in a couple days on November 1st and goes until January 31st. And this is open enrollment for 2017 coverage. 2017 coverage, even though, coverage is in 2017, we start with the poverty levels for 2016. So if you just Google 2016 FPL, then you'll get the poverty level by person, so you can see what those numbers are. I didn't want to get too bogged down in numbers, but those are findable. So look for the 2016 numbers. So that's what we use for 2017 coverage.
We'll just take a minute or so more and give folks a chance to ask any questions.
Tara, I wondered, would you just, I know you talked about this on your slides, but would you just tell me one more time, what was the percentage poverty level for cost sharing?
So for cost sharing, you have to have income below 250% of the federal poverty line. And then beyond that, there are tiers. If your income is lower than that, there are tiers of under 150%, and then 150 to 200, and 200 to 250. And at those different tiers, you're eligible for sort of more or less generous cost sharing assistance.
And was that part of the original Affordable Care Act? I didn't remember.
Yes, it was a part of the original Affordable Care Act. It's so kind of behind the scenes that people don't always understand it's happening, because they don't really tell you, oh, you get this great benefit. You just see it in, when you're looking at plans in the form of lower cost sharing. And just for reference, when we say 250% of federal poverty line, that's a family of 4 with income of about $60,000. So if you have income less than about $60,000 for a family of 4, or a little under 30 for a family of 1, then you can qualify for extra assistance that can really take the bite out of those deductibles and co-payments and out-of-pocket maximums.
And that's available with the Silver plan, is that correct?
That's correct. You have to purchase a Silver plan to benefit from those. And people get distracted by the premium, right? So they see the premium is, you know, a little bit more for a Silver plan than it would be for a Bronze plan. And unfortunately, a lot of people don't understand some of these other terms like deductible. And so they make a decision based on what they do understand, the premium. But in the end, it's going to be often, you know, more money that they're going to need to pay out of pocket before their insurance picks up. So, you know, it is quite tricky sometimes to pick a plan, especially when you know you have medical needs.
And that's where that comparison chart can really help. So thanks for sharing that with us. I wonder too if there's anything else that's kind of a hot topic in your area right now, or that's coming down the pike that you might share with us briefly.
Sure. Obviously, you know, we're on the cusp of open enrollment. So one thing that people have been and has been in the newspaper a lot is the increase in the cost of plans this year. That, you know, it looks sort of intimidating in newspaper headlines. I think that we'll probably not see quite those increases when we actually look at the plans. And one of the reasons is because the premium tax credit is covering a big portion of the premiums. And so it doesn't necessarily mean that the premium that someone is going to be paying is going to be, you know, going up a lot, because the premium tax credit is really going to take some of the pain out of that. I think that what we have learned is that insurance companies kind of underpriced to get in the market, and you can understand why that would happen because they wanted to get kind of market share and kind of get themselves settled into the marketplace. But now they're realizing that these people who are buying health insurance actually want to go to the doctor and stuff. So they realized that their plans were a little underpriced, and so they've been making some adjustments in pricing. But people should still go shopping. You know, they should still go shop in the marketplace just to see what's there. Because remember that the premium tax credit is a really valuable way to you know, take some of the bite off the premium.
Thanks, Tara.
Okay, I'm going to put a link in chat there. That's the link to the event on learn.extension.org. The recording should be available in a day or two, and we'll post a link to that on learn.extension.org. And Tara and Laura, I'll be sharing that with you guys too. You may want to post it in other locations. So last chance for any burning questions that anyone might have. Okay. Tara or Laura, any closing comments?
I want to thank Tara again for being here today, and look forward to sharing this information with our county extension agents across the state.
Great. Thank you very much.
All right. Okay. Thanks, everyone. Bye-bye.
All right. Thanks. Bye.